We set up a treatment menu called customized treatment to improve the entire skin layer for each patient. And we will also approach sagging. HIFU and Monopolar RF are the main devices for saggy treatment. Monopolar RF is not a SAMage, but it increases the metabolism of subcutaneous fat that keeps at around 45 degrees and reduce swelling by improving circulation. In many cases, the saggy treatment is performed as shown in the table. HIFU and filler, Botox, and thread lift.
And if we want to protect the skin, we have to give a pass much more than 10 milliseconds to protect skin to prevent burning. And the temperature can influence the tissue conductivity and the distribution of electrical current. If we decrease the temperature for every 1 degree, the skin impedance will increase by 2%. And the surface cooling can increase the resistance to the electrical field near the epidermis, which can drive the radiofrequency current into the tissue and increase the penetration depth. For example, in this paper, it shows a denial of monopolar radiofrequency, and we can change the super temperature, so the superficial temperature, to control the cooling penetration depth. And how to prevent burn.
You show us that to get skin tightening, the temperature should be around 51, right? Yeah. But then in your earlier talk, you say that we should keep the temperature below 42 so that the patient don't burn. So how do you reconcile this?
Yeah, this is a very important consideration. For the treatment with monopolar radiofrequency, we want to keep the temperature in the dermis to a very high temperature, around 60 degrees. But for the epidermis, the epidermis will develop blisters if above 43 degrees. So in some systems, such as Thermarch, they use the collagen spread, and they use the circuit to produce the deep heating in the dermis or the subcutis. But in the epidermis, they use the collagen to cool the superficial skin to get this best condition of skin temperature distribution.
Thank you. Do you, when you do your Thermarch, do you take the temperature of your patients, or you just go by the levels?
For in real clinical scenario, we cannot measure the real-time temperature of the dermis. So we can only use the patient feedback of the facial or superficial temperature. However, I use the measure. I can use the measurement gun to check the superficial temperature to prevent the blister formation during our treatment.
So would you say that when you do your Thermarch, you would not go beyond 2.5 level?
Pardon?
So the patient's level, right? It depends on how much the pain the patient can take. Would you say that you would like to keep it at 2.5 rather than to go at 3?
Yeah.
Okay.
I often tell my patient not to suffer from pain. I never use the topical anesthesia cream, but I use a sliding technique to spread the skin, and quickly I will accumulate the energy in a small region, and after the treatment.